Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Today we're talking about inherited cardiac disease. Doctor, is heart disease hereditary?
Some heart disease is hereditary, not the general everyday heart disease, but certainly a propensity to developing heart disease is hereditary. And then there are some types of heart disease, such as arrhythmias and cardiomyopathies, that can have a genetic component, yes.
How do you know if you're at risk for inherited cardiac disease?
You might not know if you're at risk. Certainly if you have several family members, aunts, uncles, or cousins that have had an arrhythmia or have cardiomyopathy, you may know about it. Or if a child's been born more than once in your family with a congenital heart disease, a cardiac malformation, say, or a hole in the heart, you may be at higher risk for having such a child yourself or having such a condition. But best way to know if you are at risk is to seek professional help through your physician or through a specialty clinic.
Is there an age group that is more at risk for inherited cardiac disease?
Depending on the disease, yes, but there's really a type of heart disease for every age group.
How should someone make the decision to get genetically tested for cardiac disease?
I think they need to discuss that with their doctor. We also have specialists that help people make these decisions. They're called genetic counselors. In our cardiovascular genetics clinic at UMass Memorial Medical Center, we have a geneticist, that's me, a genetic counselor, John Neary, and a cardiologist available, either adult cardiologist or pediatric cardiologist, Dr. David Kane, who's available to help you make these decisions.
When someone goes into the cardiovascular genetic unit at UMass Memorial, what should they expect?
They should expect to meet with a geneticist and or a genetic counselor to discuss their risk factors. The clinic is really for all age groups, even though it's housed in a pediatric clinic center. It's for adults and for kids. We can see all age groups. You don't have to have your cardiologist housed at UMass. They can be a cardiologist from outside to be referred to this clinic.